Performing well at the implementation station. When commencing the implementation station, you should follow exactly the same steps as you did at the assessment station. That means, as you enter the room, you should check the patient area is safe. You should draw the curtains to protect the privacy of the patient. You need to perform your infection control by doing your hand hygiene and then reintroduce or introduce yourself to the patient by name. Check that they can hear and see you okay. Perform your three-way ID check, checking the patient's name and wristband against the MAR chart. Check for allergies, and if the patient has any allergies, make sure that these are documented on the MAR chart. You also need to ask what the allergy reaction is. Ask the patient if they have any pain, and also what their pain score is, and whereabouts the pain is. If they are in pain, you will need to ask if they require any immediate pain relief and use general conversation with them to build rapport. Additionally, before you begin, you will want to check they are sitting comfortably and deal with any props. Remember, if your patient is in the community, they will not have a hospital ID band or allergy band, so you will need to ask them for their address to help confirm their ID. Before commencing the implementation station, read the paperwork to check what time it is in the scenario. This is very important when administering medication, because you need to make sure the medicine is due and you're not going to overdose the patient by providing too much of a medication within a short space of time. As normal, you will need to explain to the patient the purpose of your visit to them.
Okay, Mona, the reason why I'm here is I'll give you your 12 o'clock medications.
It is also advisable to verbalize that you have checked your surroundings to ensure that you have everything you need before going further at the station.
Before I dispense the medication to Christine, I need to make sure that the trolley is locked and the key is with me, and I have an up-to-date version of the BNF.
Before looking over the MAR chart, you should confirm that the patient is not nil by mouth and that they don't have any problems swallowing. It would be very unusual for a patient to be nil by mouth at the implementation station.
Sai, can I please check when was the last time you ate?
I had lunch about 30 minutes ago.
Okay, lovely. So according to your notes, you are not nil by mouth, so can I just quickly check if you can swallow, alright?
Yeah, that's fine.
Alright. So I'm just going to go across to your drug trolley and I will look at your due medication, okay?
Okay.
Alright.
This would also be a good opportunity to check that the patient's observations are normal.
Examiner, may I please know if Sai's last observations were normal?
Yes, they were.
Alright, thank you.
If observations are not within the normal range, there may be a contraindication to the drug you are intending to give. As you move on to reading through the MAR chart, we recommend that you verbalize as much as possible and read through the chart in a logical, structured way to ensure you don't miss any key information or spend time on medications which will not be given.
I'm checking your medication administration record here, Mona, and I'm checking it page by page to see if the information are correct. And I can confirm that the information here are correct.
You should start by reading out the patient's name and details on the MAR and confirming they are correct on each page.
I will read every page of the MAR to ensure that the patient's details are correct, including the name, date of birth, and the hospital number. And I'll also check for any allergies.
You can also verify that the other details you have for the patient are correct to show you are reading the MAR chart properly. When you get to the prescription chart part of the MAR chart, Read it from left to right, checking each line of the MAR chart in turn, reading out the date of the prescription, the correct medicine, the time it should be administered, and whether or not it has been signed by a prescriber. In particular, you want to check if there are any once-only STAT medications that are outstanding. Remember to watch out for drugs which may be made of a combination of drugs and may include a component the patient is either allergic to or has already received a dose of. For example, you would have to be careful not to prescribe co-amoxiclav or amoxicillin to a patient who was allergic to a penicillin. Equally, you would overdose the patient if you gave them cocodamol when they had already received a recent dose of paracetamol. In some situations, it may be helpful to clarify with the patient if an allergic reaction to a drug is a genuine allergy, or perhaps an unpleasant side effect such as GI discomfort. If the patient has oxygen prescribed on their MAR chart, you should check their oxygen saturations so you can assess its effectiveness.
Now, under your prescribed oxygen therapy, it says here that your oxygen therapy has been discontinued an hour ago. So, how are you feeling without it?
Yeah, I feel okay actually.
Examiner, can I just ask for the latest oxygen saturations of the patient? Okay, so your target oxygen saturations is at 94 to 98, and right now you're at 95%, which is good. But if in case you have problems breathing, just let us know so that we can assess you and maybe continue your oxygen therapy, okay?
Thank you.
All right.
When reading through the patient's regular medications, you will want to ensure none of them will interfere with the other medication the patient has been prescribed. If something seems a little strange to you as you are going through the MAR chart, you can also ask the patient to clarify this for you. For example, if you see that the patient has been prescribed a medication in the afternoon, which is usually taken in the morning, you can ask if that's normal for them. It is also very common in the OSCE for a PRN to be listed. If your patient is in pain, you will need to look at whether any analgesics can be administered. If no analgesics are due, but the patient is in pain, you should offer to speak to the doctor to provide them with some more immediate relief.
Okay, Mana, I can see that your PRN, under your PRN medications, you have paracetamol, 1,000 milligrams for pain. Now, it's not due until an hour. Do you want me to ask your doctor to give you an alternative pain medication?
No, I'm okay actually.
Okay, but if in case you change your mind, just let me know, okay?
No, it's fine, I can wait.
If the patient is on an IV medication, remember you will need to check the cannula site to ensure it is not inflamed.
Now, while I'm here, would it be fine if I just check your IV site?
Yeah.
Okay. So it says here that you're on IV for hydration, and your fluid is at 0.9 sodium chloride, and it should run for 8 hours, and it was started at 9 a.m. Okay. Now your fluids are not due to finish, but would it be fine if I check the site?
Yeah.
So there's no sign of inflammation, redness, or thrombophlebitis, so that's good. Now, if I may just ask, is it uncomfortable?
No, it's fine. Thank
Okay,
you.
that's good. Now I'll just leave it to continue to infuse, alright? Okay. But let me just check the batch number. So batch number is BNG1F1345. So I can confirm that it's correct.
Remember that some drug names can be very similar to each other, so be sure to confirm you definitely have the correct drug to avoid a drug mix-up.